Concerns are mounting as a medical crisis triggered by cholera outbreak worsens across IDP camps, exacerbated by a leadership gap due to delayed appointment of a new Minister of Health. The situation has significantly slowed down medical response efforts. The Minister of Humanitarian Affairs and Disaster Management, Albino Akol Atak, put forward these concerns during a meeting with officials from the Ministries of Health and Water Resources, along with the representatives from United Nations agencies and humanitarian organizations in the country. Isaac Lodoro reports.
The Ministry of Humanitarian Affairs and Disaster Management is soliciting support from line ministries and partners in fixing challenges confronting refugees and internal displaced persons in the country. Speaking to SSBC, Minister Albino Akol Atak says he is consulting with the line ministries and partners on coordinating activities for managing and preventing the spread of cholera.
We are satisfied that there is a lot of efforts that are going on to prevent the spread of cholera and to manage it. The little challenges that we got is connected with the coordination and of course funding and the resources. So we have now resolved that we strengthen coordination so that we identify who's supposed to take a decision on a certain level.
The Deputy Special Representative of the United Nations Secretary General and the resident humanitarian coordinator Anita Kiki says the government and the partners have to work together in fixing cholera outbreak and spread and in addressing humanitarian challenges.
The response effort is clear, cannot be done by any one partner. It cannot be a ministry alone. It cannot be a coordination actor alone. But what is most important is that we come together despite the challenges and try to ensure during the rainy season we do not see a rise in cholera rates, but we try to flatline.
In a separate development, Minister Akol Atak and Justin Charles Abiejok, Chief Administrator of Abia Administrative Area, reviewed the humanitarian situation of refugees and IDPs in the administrative area. Minister Akol says the current humanitarian crisis in the country dictates reintegrating IDPs in their areas of origin.
And as you know that Abia is one of the transit site and entry points. So he reported to me about the number of refugees, Sudanese refugees, that needed to be transported into refugees camps that are near to the area. One of these is Wedwil in northern Bargazal, and the other is in Ruweng administrative area.
Abiejok underscores the necessity to relocate refugees and IDPs to safer locations in the current growing humanitarian demands and the diminished funding from the global community.
We have so far a very huge number of refugees. They have not yet reached the refugee camp in Will. So I've shared with him and he asked him to coordinate with the other partners so that they can be transported to their refugee camp in either Will or any other places that are provided for the refugees.